I understand your concern about cancer, but it's important to note that there is no single food or diet that can kill cancer. Cancer is a complex and multifaceted disease, and its treatment and prevention often involve a combination of medical treatments, lifestyle choices, and dietary changes. However, a well-balanced diet rich in certain foods can play a significant role in reducing the risk of developing cancer and supporting cancer patients during treatment. In this video, we will discuss some of the best foods that have been associated with cancer prevention and management. Fruits and vegetables. A diet high in fruits and vegetables has been consistently linked to a reduced risk of various cancers. These foods are rich in vitamins, minerals, antioxidants, and dietary fiber, which collectively help protect cells from damage and support the body's natural defense mechanisms. Cruciferous vegetables. These include broccoli, cauliflower, cabbage, and Brussels sprouts. They are known for their high levels of glucosinolates, which may help reduce the risk of certain cancers, such as breast, lung, and prostate cancer. Berries. Berries like blueberries, strawberries, and raspberries are packed with antioxidants like anthocyanins and vitamin C, which can help neutralize free radicals and protect cells from damage. Citrus fruits. Oranges, grapefruits, and lemons contain vitamin C and other phytochemicals that have been associated with a lower risk of stomach, esophageal, and pancreatic cancers. 2. Whole grains. Consuming whole grains, such as brown rice, whole wheat, quinoa, and oats, can provide important fiber and nutrients. Whole grains can help regulate blood sugar levels and promote a healthy weight, reducing the risk of several cancer types, including colorectal cancer. 3. Leafy greens. Dark, leafy greens like spinach, kale, and Swiss chard are packed with vitamins, minerals, and antioxidants. They are also high in fiber, which can help support digestive health and reduce the risk of colorectal cancer. 4. Legumes. Beans, lentils, and chickpeas are excellent sources of protein, fiber, and other nutrients. Regular consumption of legumes may help reduce the risk of colorectal cancer and support overall health. 5. Tomatoes. Tomatoes are rich in lycopene, a powerful antioxidant that has been linked to a reduced risk of prostate cancer. Cooking tomatoes and adding a source of healthy fat, such as olive oil, can enhance the absorption of lycopene. 6. Garlic and onions. Both garlic and onions contain sulfur compounds that have been associated with a lower risk of stomach and colorectal cancers. These compounds may help inhibit the growth of cancer cells. 7. Green tea. Green tea contains polyphenols, particularly epigallocatechin gallate, EGCG, which have antioxidant and anti-inflammatory properties. Regular consumption of green tea has been linked to a reduced risk of various cancer types, including breast, prostate, and colorectal cancer. 8. Nuts and seeds. Nuts and seeds, such as almonds, walnuts, flax seeds, and chia seeds, are excellent sources of healthy fats, fiber, and antioxidants. They can support overall health and may help reduce the risk of certain cancers. 9. Fatty fish. Fatty fish like salmon, mackerel, and sardines are high in omega-3 fatty acids, which have anti-inflammatory properties. These healthy fats may help reduce the risk of colorectal and breast cancers. 10. Turmeric. Turmeric contains curcumin, a powerful antioxidant and anti-inflammatory compound. Some studies suggest that curcumin may help prevent or slow the growth of cancer cells, particularly in cancers like colon, breast, and prostate cancer. 11. Mushrooms. Certain mushrooms, such as shiitake and maitake, contain compounds that can boost the immune system and potentially inhibit the growth of cancer cells. They are often considered immune-boosting and cancer-fighting foods. 12. Probiotic-rich foods. Fermented foods like yogurt, kefir, and sauerkraut contain probiotics, which can help maintain a healthy gut microbiome. A balanced gut microbiome is linked to reduced inflammation and may lower the risk of certain cancers. 13. Dark chocolate. Dark chocolate with a high cocoa content is rich in antioxidants, including flavonoids. These compounds have been associated with a reduced risk of certain cancers and may help protect cells from oxidative damage. 14. Carotenoid-rich foods. Foods like carrots, sweet potatoes, and butternut squash are rich in carotenoids, which can help reduce the risk of lung, mouth, pharynx, and larynx cancers. 15. Berries. Berries such as blueberries, strawberries, and raspberries are packed with antioxidants and phytochemicals that can help protect cells from damage and reduce the risk of several cancer types. 16. Apples. Apples are a good source of fiber and antioxidants, particularly quercetin. Regular consumption may help reduce the risk of colorectal and lung cancers. 17. Avocado. Avocado is a source of healthy fats and contains various antioxidants and phytochemicals that may help protect against oral cancer and other cancer types. 18. Ginger. Ginger contains gingerol, a compound with anti-inflammatory and antioxidant properties. Some studies suggest that ginger may help prevent or slow the growth of cancer cells, particularly in ovarian and colon cancers. 19. Red grapes. Red grapes, particularly their skin, contain resveratrol, a polyphenol with antioxidant properties. Resveratrol has been associated with a reduced risk of certain cancers, including breast and liver cancer. 20. Flax seeds. Flax seeds are rich in lignans, which are compounds with antioxidant properties. They may help reduce the risk of breast, colon, and prostate cancers. While these foods have been associated with cancer prevention and overall health, it's important to remember that no single food can prevent or cure cancer. A balanced and varied diet that includes a wide range of fruits, vegetables, whole grains, and lean protein sources is key. Additionally, other factors such as genetics, lifestyle choices, and regular screenings also play a significant role in cancer prevention and management. If you have concerns about cancer, it's essential to consult with a healthcare professional for personalized advice and guidance.